Availability of Healthcare and Options by Stephanie Baruman. Being able to afford healthcare and knowing what is available to you is a big issue and definitely affects the vulnerable population. People are scared to seek help and think that they have little to no options, especially if funds are tight. People in our communities need to be educated on what is actually available to them. In Wichita, there are so many different options as far as seeking health care, but not everyone knows the availability or where to find these programs. In some communities, they are low income and healthcare is an aspect that often gets neglected. Making people aware of resources available to them will equate to more people potentially seeking out healthcare and treatment. So many people believe that healthcare is too expensive, and if they don't have insurance, then they cannot be seen. This is absolutely not true. So the question is, where can I go to be seen? In Wichita, we have so many urgent care facilities. They are literally on every corner. We have multiple low-income facilities that are listed below. The Sedgwick County Health Department, Planned Parenthood, we have multiple hospitals in the area, Center for Health and Wellness, the Medical Services Bureau, and then multiple primary care offices located all throughout the city. In Wichita, there is definitely an overabundance of urgent care clinics in the community, and there's almost one on every corner. These facilities provide minor emergency needs for adults and children on a walk-in basis. They treat anything from broken bones, sprains, wounds and cuts to the common cold, and they even do physicals. These facilities primarily only take insurances, and if paying out of pocket, they can be rather pricey, but this can be an option if you're unable to get into your primary care physician. Low-income clinics will probably be the best bet for these vulnerable population. There's multiple clinics throughout the city, and the primary ones are the Grace Med Health Clinic, Hunter Health Clinic, the Good Samaritan Clinic, and the Guadalupe Clinic. These are for the uninsured and underinsured or even low-income patients. Some of these facilities require proof of income and go off of a sliding scale basis, but they do provide a multitude of services at low costs or even free. They provide a range of services from women's and men's health, STD testing and treatment, medical, OBGYN, optometry, diabetes care, mental health counseling, and so on. From what I could find, they all require appointments to be seen, but they all have licensed professionals. The Sedgwick County Health Department offers so many services, an entire list is available on their website. They offer everything from vaccinations, well body exams, services to women, children, and their families, oral health, and an array of screenings and tests. Medicare, Medicaid, private insurances, and self-pay based on a sliding scale are accepted as forms of payment for services rendered. Health discount cards are even available, and they can also help you get low-cost prescriptions. Wichita does also have a Planned Parenthood. This is available to the public and offers women's and men's health care. They offer STD testing and treatment, HIV testing, pregnancy services, birth control, emergency contraception, and abortion referrals. They accept Medicaid, Medicare, private insurances, and they also do help the uninsured patients. Some fees are on a sliding scale basis based on your income, and donations are always accepted. The local hospitals in Wichita all offer emergency services and other health necessities. They accept all major health insurances as well, and each of the hospitals seem to have their own area of specialty. The hospitals in the area is Wesley Medical Center, Wesley Woodlawn, Via Christi St. Francis, Via Christi St. Joseph, Via Christi St. Teresa, and Kansas Medical Center, to name a few. Two other options in Wichita is the Center for Health and Wellness, which provides medical and behavioral services on a sliding scale. They primarily focus on general services, but they do offer outpatient and intensive outpatient substance abuse treatments and group therapies, and also alcohol and drug education programs. We also have the Medical Services Bureau, which offers vouchers for prescription drugs, diabetic supplies, Medicare Part D copays, prescription eyeglasses, and reduced cost eye exams for low-income people who live or work in Sedgwick County. They do also help clients obtain prescription medications from pharmaceutical companies. How can I get to my appointments? This is another large issue that people face in regards to their appointments. Wichita offers numerous services to the local population in regards to getting to and from health-related appointments, and there are also other options for patients to consider as well. Some of the local transportation options is the Sedgwick County Transportation. They provide non-emergency transportation on a first-come, first-served basis with funding availability. Applications must be filled out and transportation is available Monday through Friday from 8 to 4:30, and they do have sliding scale fees available. There are other multiple non-emergent transportation companies available as well. Medicare and Medicaid other insurances do typically cover this if this is a medical necessity, and I did list a few below. There is also Wichita Public Transportation, and then one that some people don't normally think of would be Uber or Lyft. These prices are based solely off of distance, and insurances are not accepted, and also if the patient is wheelchair bound, this may not be an option for them. Making healthcare options to the low-income and vulnerable population public knowledge would help immensely and potentially drive more people to actually be seen. To make it known that a majority are on a sliding scale basis and sometimes only a small donation is accepted to be seen would drive more people to be assessed. Increasing knowledge on this could equate to fewer illnesses that could in fact have been caught early. Knowledge is power after all.